Meet Mrs. Amelia Blackwood, a 54-year-old librarian with a peculiar complaint. In a world where the extraordinary often hides in the shadows of the ordinary, we find a case that confounds even the brightest of minds in the medical field. Amelia Blackwood, a seemingly average woman, was plagued by an unusual sensation, a feeling that her bone was dissolving. Over the span of just 1 week, she felt her left femur, the largest bone in the human body, gradually disappearing, as if it were being eaten away. She presented herself to the hospital, her distress palpable, yet there were no visible signs of trauma, no outwardly visible symptoms that could validate her excruciating pain. Initial examinations, however, hinted at something sinister lurking beneath the surface, a mystery veiled in the depths of her biology. Despite the distressing symptoms, the first round of investigations revealed nothing more than a baffling mystery. The medical team launched into a thorough investigation, hoping to shed light on Mrs. Blackwood's unusual condition. The first step was to conduct extensive laboratory tests, from blood panels to genetic testing, all aimed at uncovering any metabolic disorders or infectious agents that might explain the bizarre symptoms. But every test came back within normal limits, effectively ruling out common culprits like osteoporosis or osteomyelitis. Next, they sought the expertise of specialists from multiple disciplines: orthopedics, rheumatology, infectious diseases, anyone who might offer a fresh perspective or a hitherto unconsidered diagnosis. Yet despite this collective wealth of knowledge and experience, a definitive diagnosis remained elusive. Each specialist was just as baffled as the last, unable to account for the peculiar, gradual disappearance of Mrs. Blackwood's femur. Despite their best efforts, the medical team was left scratching their heads, with Mrs. Blackwood's condition remaining a puzzling enigma. With no clear diagnosis, the focus turned to managing Mrs. Blackwood's discomfort. Pain management medications were prescribed, aiming to alleviate the severe pain she was experiencing. However, the peculiar phenomenon continued to unfold. Her left femur, the longest and strongest bone in the human body, was gradually disappearing, as if vanishing into thin air. Within 2 short months of her initial presentation, the unimaginable had occurred. Her left femur had practically vanished, leaving behind only a faint shadow on imaging studies. The bone that was once a robust structural pillar, now reduced to almost nothing, an eerie ghost of its former self. Despite exhaustive efforts by the medical team, the cause of her bizarre ailment remained elusive. Numerous specialists were consulted, countless tests were conducted, and yet the riddle remained unsolved. A woman's bone was disappearing, and no one knew why. As we stand today, Mrs. Blackwood's case remains an unsolved medical mystery, a testament to the enigmatic nature of the human body and the complexities of medicine.